Hello, thanks for having me come and speak today. This is a re-recording of a talk that I've given for the annual conference of the National Hepatology and Tropical Medicine and Research Institute in Cairo, Egypt. I wanted to make it available for my colleagues in the United States and elsewhere. So I'll go ahead and get started. This is obviously a large topic, and I couldn't possibly cover it in the 15 minutes that was given to me for the conference, but this is just a beginning of this conversation, and so let's go ahead and get started. So looking at World Health Organization data from Sunday, December 6th, in the globe, around the world, there's been more than 1.5 million deaths associated with COVID. In the United States, there's been more than 276. And last I heard, of course, the latest data is now we're over 285,000. And of course, in Egypt, population is smaller, and the number of deaths has been significantly less than within the United States, but we're looking at 6,750. And we're going to be using this data after the next few slides and some calculations that I've made to look at the impact on our loss as a result of these deaths. So in general terms, the financial impact of COVID has, on a personal level, caused lost jobs and with that, lost income. We're also seeing a significant number of women stepping out of the workplace to take on caregiver roles for elderly parents and family, as well as for their children. It's not always women. There are men that are doing this as well, but it's predominantly hitting women more than men. Of course, in the United States, we're seeing a loss of healthcare insurance because it's tied often to our employment, and that is a little bit different than it is in the rest of the world where there are universal healthcare systems. We're seeing certainly an increase in food insecurity, and what I mean by food insecurity is that many people don't have the money now that they don't have jobs to buy food. So we're seeing an increase, a significant increase at food banks and other charities to help provide food to those without income. We're also seeing the beginning of evictions and foreclosures, I believe, and that's a concern as well. And I can speak specifically to the United States, but I know that this has been happening a bit around the world. More broadly speaking, we are seeing a significant, obviously, impact on small and large businesses. We're seeing and seeing many small businesses being challenged by COVID-19 and the pandemic and through lockdowns and stay-at-home orders, and some have already closed for good, some have closed for a period of time, others are or will be closing, and we've seen some large businesses that may have been weak being affected by the changes in our economy as a result of COVID. Certainly, there's been a significant impact on supply chains as we think about the logistics of providing material for manufacturing. Of course, the travel and airline industries have been deeply affected by COVID and this pandemic. The hospitality or hospital or hotel industry, of course, as well as part of that has been affected. Use is way down. We're seeing, of course, restaurants and cafes losing business. Many have closed, more will, based on various news reports. Food processing companies, those like Hormel and others, have seen outbreaks in their facilities, and so sometimes they've had periodic closures or postponements or certain lines closed, and that's when I talk about meat processing, we're talking about beef, pork, poultry, and then of course I mentioned manufacturing. So some appliances can't be made because they don't have all the parts that they need. When we think about leisure industries, we're talking about professional sports, collegiate sports. You can see an empty stadium in one of the photographs that I've included here, as well as we see Mickey and Minnie Mouse from Disneyland, which had for decades been known as the happiest place on earth. And while that may be the case under non-pandemic times, Unfortunately, Disney, which is a very large company with many holdings, has announced that it's letting go 32,000 employees. So big changes. And then, you know, as a result of some of the changes in how we interact and how we are out and about, we're seeing an increase in streaming services for television, but we may not be going to movies at theaters or going to concerts. We're doing much more online shopping for those that can do that. So let's take a quick look at the social impact. Obviously, we're talking about death of family, friends, business, and community leaders, and that's a significant impact. We, of course, in Europe and around the world and in the United States, depending on what language you like to use, we've certainly experienced lockdowns and stay-at-home orders. That has definitely changed and affected how we go about our daily lives. It's increased under COVID the use of social media to stay connected, increased the use of web and video conferencing. This was the conference in Egypt, originally an in-person conference, and others have been also scheduled to be in person, but we're doing more and more video conferencing to allow remote connection and to allow us to continue to communicate with one another. And as a result, certain businesses have gone way up, and that includes companies like Zoom, who have been used for business, but now are being used for personal use on a great high level. We also have seen significant reduced intergenerational family interaction. And that, what I mean by that is that because COVID has disproportionately affected, or we have been concerned about the impact on the elderly, we have kept grandchildren from grandparents as well as middle-aged adults from their older parents because we don't want to infect them. Many are in nursing homes or other care facilities, and so a bit more isolated. But this has been a real challenge for us, particularly in the United States over the last 9 months. You know, in Asia, it started earlier, but we are dealing with that as best we can right now. And then in general, here's a quick list of where we've seen reduced in-person social interaction. This may not be completely comprehensive, but certainly we have seen, you know, what we took for granted as, you know, we used to call it the water cooler talk at the office. We would get together and chit chat about what we did on the weekend with our business colleagues and friends. So we don't do that as much or at all. Maybe we do it through Zoom or through the phone, or online, but it's not quite the same. Certainly, there's been a huge impact on our ability to go to places of worship. Many are still connecting through online services, but it's not quite the same of going to your place of worship. Community groups of various kinds have had to limit or completely eliminate their meetings. Certainly, the operations of long-term care facilities and our ability in the public to go to them has been changed quite a bit. Elementary schools have changed. Many have gone remote or have hybrid programs, and that's quite different than we would normally expect. And of course, universities are doing the same thing, trying to contain outbreaks or to prevent them from occurring. So many university students are doing remote learning, even in the same town where the universities are, from their apartments. We also have seen many fitness centers, depending on, you know, the outbreaks or the positivity rates in their communities, put up or allow a certain number of folks to come in and use their services, and then others have been more closed, depending on their locale. Certainly seen a huge impact on youth programs, and that can include sports and other kinds of educational activities, music lessons or orchestra concerts, things like that. And for adults and children and teens, intramural sports have been deeply affected by the pandemic. I touched on this, but we've seen a significant change in childcare responsibilities as a result of the pandemic. Many times, parents who are working hire babysitters or nannies or others, or have family members who take on responsibilities for watching their children, often parents, older parents. but we aren't able to do that as much as we would under normal times. And so many parents are actually staying home to raise their children. That wouldn't necessarily be a bad thing, except for that may not be what people have wanted and invested in terms of their educations, but also has a significant financial impact by the loss of income. And then in general, we have seen an increase in social anxiety. And when I talk about social anxiety, we're talking about situations where people are concerned about being in large groups in public. And we've seen that ebb and flow depending on positivity rates during the summer, certainly in the United States, but around the globe. Certainly we were seeing that in Europe and in certain Middle Eastern countries. In general, obviously there's a great deal of increased stress. And for some, even in small family units, when they aren't able to go to work and do their intramural sports and be in their community groups, there's a greater sense of isolation than they'd had before. So the impact on the healthcare industry is quite significant, with that being possibly a pretty obvious kind of thing. Early on, we were concerned about overwhelming our intensive care units and hospitals to deal with those who were so severely ill. Very quickly, we saw a rise in telehealth for all kinds of primary care and therapy type sessions. As a result of the pandemic, we've certainly seen a reduced level of elective surgeries, and as a result, significant lost revenue in hospitals and health systems, which has led to many layoffs or furloughs in those institutions because so much of their work is focused on COVID. According to the United States Centers for Disease Control and Prevention, and this was data as of earlier this week, there's been about 255,000 healthcare workers infected and 845 dead. Now, according to the National Nurses Union, they say that more than 1,700 health workers have died in the United States as a result of COVID. So, however you look at this, across the globe, we're seeing burned out healthcare workers, and as a result, we may be seeing a significant loss of dedicated skilled professionals through death, early retirement, or in many cases, some of our caregivers, most highly skilled and trained doctors, nurses, and other professionals have had to take on a caregiver role for a parent or for a child or children. We're hearing about periods of impairment related to alcohol use or drug abuse, but also depression. It's got to be a significant issue with the sense that there is no real end in sight for many right now, with also the increase in cases, the surges as we call them. That's a lot to deal with. And while it may not be widespread, we are certainly aware globally, but also in the United States, of concerns, a sense of overwhelm that has led to suicide. And there is a photograph of a bright, smiling, highly educated and trained and dedicated emergency room doctor by the name of Lorna Breen. She was a New York physician who committed suicide earlier this year, and that tragic story was promoted, or rather the media made us aware of her situation. And so there is a real cost and loss from this pandemic. So while I can't do a calculation for every aspect of our financial or economic life, as well as our social life, in terms of what the pandemic has done to us and how we've been affected by it, what I can do is estimate the impact on the loss of human potential, and we do that using what are called quality adjusted life years, or QALYs, as an estimate, as I said, for the loss of human potential and the contribution to their families and society. QALYs are a standard economic measure for the value of 1 year of human life where there is premature death or a significant disease burden or disability. I should note that the calculations that I'm going to share with you focus only on the human impact due to death, not temporary or long-term health impairment, which sometimes is calculated if someone's living with disability. Once we're talking about here death, there is no disability, and I'm not doing a calculation for those who may be known as long haulers or who may have been in hospital for several months Not trying to do that, just trying to work with some of the basic data that we have available. So we are not dealing, again, with the economic challenges from businesses closing or the significant reduction in the use of services or products. But I'll go ahead and get into my calculations now. So based on my calculations today, the global loss of human potential may be as much as $4.6 trillion US. If we're looking at more than 1.5 million dead around the world. You can see the calculations right here. It's hard to, to calculate exactly, predominantly the COVID pandemic has affected a large number of elderly, but it's also affected a fair number of middle-aged as well as young people. And I don't have a great age breakdown, so I'm just being conservative here. So if we look at an average loss of 15 years per individual with an average $100,000 value per year, we're looking at $2.2 trillion in lost human potential. We can go all the way up to 30 years of lost human potential, and that gets us to the $4.6 trillion lost. And for the purposes of the audience that was in Egypt, I calculated that in Egyptian pounds at 71 trillion, which is pretty significant no matter how you look at it. But what does $4.6 trillion US look like? Well, it's 5% of the global gross domestic product, which comes in at about $92 trillion. It's 20% of the United States gross domestic product of around 20.5 trillion. It's 34% of China's gross domestic product, which is 13.4 trillion. It's slightly less than Japan's entire annual gross domestic product of almost 5 trillion. And it's just a bit more than Germany's entire GDP. So that's $4 trillion in Germany for their gross domestic product. Looking at a map of Europe, that's as if the entire economy of Germany was wiped out for a year completely. And that equals, if you were to add or combine Canada's and the United Kingdom's gross domestic product, that's about what we've lost so far in this pandemic. It's also, again, depending on what region of the world you live in and like to think about, that would be if we combined, it would be the same as if we combined the gross domestic products of Brazil and India. So pretty significant. And this is not to only think about human beings in terms of dollars and that kind of value, but it is a way to help paint a picture for us to wrap our mind around the significance. We can't talk or quantify, love, strictly speaking, as love, but we can talk about the impact that those we love have in our lives and in our communities and in our society. And so thinking about, while we talked about globally, in the United States alone, and of course the number since Sunday has increased, but according to the WHO website, we were at just over 276,000 US dead. We're talking up to a potential loss of human potential in the United States alone since the pandemic hit of about $830 billion. And for purposes for comparison, in Egypt, they have lost, with just 6,750,000 dead, the equivalent of about $20 billion in lost human potential. So again, still pretty significant. Egypt is, by comparison, obviously, to the United States, a much smaller country, but these are not insignificant things to think about. So in conclusion, I would say that, as much as we want to be at the end of this, but we're still in the middle of this global pandemic now, and that COVID-19's impact will be felt. And it's not just me saying this, but clearly other professionals in this area have said that this is going to be felt for a decade or more, and that COVID-19 has in fact profoundly changed how we interact as communities and economies, and perhaps forever. Let me reiterate, the global loss in human potential may be as much as $4.6 trillion US so far, and by the end of 2021, it may double or triple depending on many of the steps that we take to mitigate the spread of COVID-19. The good news is that vaccines are coming and will be available soon to our most vulnerable as well as healthcare workers. And even better news is that the United Kingdom began its vaccination program just on Tuesday, December 8th, and that vaccines will become broadly available to the general public starting in the spring and summer. So that's the good news. And I have other data that I'll be sharing in our write-up, but I wanted to thank you for your time to listen to my presentation, and I'd be more than happy to answer questions offline and receive your emails. So thank you very much. You can reach me at Stephen, S-T-E-P-H-E-N, at davidowquality.com. Take care. Thanks so much for listening.